Welcome to this explainer. Today, we're taking a fascinating journey inside the human body to look at a truly miraculous process. If you've ever stared at an ultrasound monitor and felt just a little bit lost in all those shadowy gray shapes, well, you're in exactly the right place. We're going to use a clear spatial map and some really simple language to break down these sonographic images and completely demystify what placental positioning actually means for a pregnancy. Okay, let's dive into this. Take a second and think about your own ultrasound results, or maybe the results of a loved one who's expecting. One of the absolute first things a sonographer looks for on that screen is the location of the placenta. But why? Do you actually know where your baby's placenta is located right now? Today, we're going to act as your personal tour guide through the 3D space of the uterus, translating all that medical jargon into simple language so you can perfectly picture what's happening in there. Here's our quick roadmap for this explainer. 1. We'll meet the placenta. 2. We'll cover front and back positions. 3. Top and side positions. 4. We'll look at low-lying and previa. And finally, 5. Why ultrasound knowledge empowers you. Section 1. Meet the placenta. So what exactly is it? Well, by definition, the placenta is a temporary organ that develops during pregnancy. And just think about how wild that is for a second. The human body literally grows an entirely new, temporary organ from scratch just for this one specific journey. When a sonographer points out that thick, kind of pancake-like structure on the monitor, that is the placenta. It's totally central to the whole pregnancy journey, basically acting as the baby's main life support system. To really appreciate what we're mapping out today, let's quickly run through the placenta's 4 vital jobs. First up, it supplies oxygen and nutrients directly to the baby. Second, it acts like a high-tech filtration system, removing waste products. Third, it's essentially a hormone factory, producing the important hormones needed to sustain the pregnancy. And fourth, it physically connects to the fetus through the umbilical cord. You can actually see those blood vessels pulsing on a high-quality ultrasound. It's an incredibly busy, essential organ, which is exactly why identifying its physical location in the 3D space of the uterus early on is so crucial. Section 2. Front and back positions. Now, what's really interesting about this is how it explains a super common ultrasound finding. When we say someone has an anterior placenta, we simply mean it's attached to the front wall of the uterus, the side closest to your belly button. And let me be clear, this is a completely normal finding. Sonographically speaking, it just means the placenta implanted right at the front. But the really cool thing about this is how it physically affects the mother's experience. Because it's sitting right there at the front, it literally acts like a shock absorber. So mothers with an anterior placenta might actually feel those precious first kicks a little bit later in the pregnancy, simply because the placenta is physically cushioning the baby's movements. Then on the flip side of that, we have the posterior placenta. This just means the placenta is located on the back wall of the uterus, closest to the mother's spine. And I want to assure you right now, just like the anterior position, this is a perfectly normal place for it to be. It's just another standard, safe attachment zone. Let's compare the two to really highlight the difference. With an anterior placenta on the front wall, you've got that extra cushioning, right? So movements are felt a bit later. But with a posterior placenta on the back wall, there's a lot less tissue between the baby and the mother's abdominal wall. Because of that direct line of contact, many mothers with a posterior placenta report feeling those little flutters and kicks much, much earlier. It's just a beautiful illustration of how physical placement inside that 3D space directly dictates a mother's day-to-day experience. Section 3. Top and side positions. Okay, moving on, we have the fundal placenta. In medical terms, the top portion of the uterus is called the fundus. So if your ultrasound reveals a fundal placenta, it simply means this amazing temporary organ has attached itself right at the very top, essentially on the roof of the uterus. This is an absolutely fantastic location. It's well out of the way of the exit, and it usually supports really healthy fetal growth. It's exactly the kind of normal, glowing sonographic image you love to see during an exam. Next up is the lateral placenta. And lateral is really just a fancy medical way of saying it's attached to the side, either the right side or the left side of the uterus. When the ultrasound tech is scanning across your belly, they might jot down a right lateral or left lateral position. Once again, this is totally normal, just another variation of placement that usually doesn't cause any complications at all. As we're seeing, the placenta has a pretty wide variety of totally safe, normal places it can call home. Section 4. Low-lying and previa. Let's define this one clearly using simple language. The cervix is the internal opening at the very bottom of the uterus. Basically, it's the exit door for the baby. Now, when the placenta is located really close to or completely covers the cervical opening, it's called a low-lying placenta, or placenta previa. During an ultrasound, the technician is going to look extremely closely at the exact distance between the edge of the placenta and that internal cervical opening. So, the crucial point here is understanding why this specific bottom placement needs a little extra attention. Now, having placenta previa absolutely doesn't mean you need to panic, not at all, but it does require watchful care. See, because the placenta is sitting over or very near the exit, this condition might cause some bleeding during the pregnancy as that lower part of the uterus naturally stretches. Therefore, it requires careful ultrasound follow-ups and steady medical supervision. Your doctor will use those sonographic images to keep an eye on things and monitor if the placenta actually moves up and out of the way as the uterus grows, which, by the way, it very often does. Section 5. Why ultrasound knowledge empowers. And this brilliantly illustrates our entire spatial tour today. Just to quickly recap, we have the anterior position at the front, posterior at the back, fundal at the top, and lateral on the sides. Every single one of those is a completely normal variation. Then we have previa down at the bottom, which simply requires some routine medical supervision. Knowing the type and position of your placenta isn't just fun medical trivia. It's a wildly important part of every pregnancy ultrasound. It explains exactly why you might feel those kicks earlier or later, and it helps you understand precisely what your care team is monitoring. It demystifies the whole screen and puts you firmly in the driver's seat of your own health journey. The placenta is an absolute marvel of biology. It acts as your baby's temporary lifeline, working tirelessly 24/7. And now that you have this visual, spatial map in your mind, you can walk into your next appointment with total confidence. So as you prep for your next checkup, ask yourself, armed with this new knowledge, what will your next ultrasound reveal? Are you going to be looking at the roof, the front wall, or the sides? Thank you so much for joining me on this explainer. Keep asking those great questions, keep looking closely at those sonographic images, and never stop learning about the absolutely amazing things happening inside the human body.